Welcome to the CodeCast podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the 199th episode of the CodeCast podcast. My name is Terry Fletcher. So today I decided to go back to a post I made on LinkedIn a couple of weeks ago. I've had over 11,000 hits, 295 comments, and about, I think, what is it up to? Over 1,000 reactions. Very positive, but everybody just like, finally, somebody put it out there. And the topic is HIPAA. And I just feel like not everyone knows what it means. And it's not to say anything about my listeners or coders or any medical professionals out there, but just lay people that are claiming everything from you can't ask me that question because it's HIPAA, to professional athletes saying we can't ask them if they were vaccinated, to somebody else saying, you can't ask me if I walk into a restaurant to show proof or whatever. And those of you that know me, I vaccinated under protest. That was not me. And I was hesitant because it's not approved yet and I just don't know what's in it. And I'm still not sure if it was a good idea, but I think for me and for my bubble of who's around me, I think it was what I needed to do. So hopefully you've talked to your doctor and figured it out. But back to HIPAA, I wanted to really talk about this because everyone is using it incorrectly, and they're using it as more of a crutch and a default to basically not divulge information that they either need to or they just don't want to. So let's really talk about it. And if maybe you don't know what HIPAA means, really, it's something that came out in 1996, and I just wanted to explain it to you because HIPAA, the health privacy law, it's more limited than you think, and that's really not all it stands for. So the first thing you should know about HIPAA is that it's HIPAA, not HIPPA. There is only one P, and that does not stand for privacy. People make up that acronym and what it stands for. And I've heard that also from different people in the Department of Health and Human Services. They say, yeah, everybody makes that up. More often than not, they think it's Health Information Privacy Protection Act. There is no law that exists that has the HIPPA or that spelled out information. That's not what it is. There's even been reporters that have asked our government officials that have been vaccinated, or asked them if they have been, people at the top level of government, and said, and also I just recently, Dallas Cowboys quarterback Dak Prescott, and they're saying, oh, it's a HIPAA violation by asking the question, or somehow violating somebody's HIPAA rights by saying, have you been vaccinated? And that is not correct. So it's not a HIPAA violation. More and more employers and schools are mandating that their employees and students get vaccinated. And so this question keeps coming up. So let's get the big question out of the way first. Is it a HIPAA violation, HIPAA, for your employer to require vaccines? No. Nor is it a HIPAA violation for them to ask for proof that you have been vaccinated, though many people seem to think that providing or even soliciting any sort of health information automatically becomes a HIPAA issue. Employers do have to keep their employees' vaccination statuses confidential within their employee file, but that's because of the Americans with Disabilities Act, not HIPAA, which again does not apply here. So why is HIPAA so misunderstood? Well, the misspelling and the widespread belief that HIPAA confers to a strict set of privacy protections to any and all health data, and that everyone is subject to those laws, that's where the mistake is. And again, the problem is that with HIPAA and most patients only come across it when signing the notice of privacy practices that the law mandates their healthcare providers have them sign. Most people consider their health information to be very sensitive and assume that their congressmen or lawmakers put the appropriate guardrails in place to make sure that it's as private as possible. But HIPAA's privacy rules are very limited and more than you may realize. So HIPAA has great branding because everyone knows the acronym, but they spell it wrong for a lot of reasons. It's not well understood on its limits. It's very specifically a law that regulates information that is collected because a person is seeking health care. So what's really annoying to me is that the misunderstanding would probably be no big deal, but the pandemic has helped bring health privacy issues into the foray, as with many other things over the last year. So we've moved many of our health interactions online. Some of those may not be covered by HIPAA, but many simply assume they are. As the pandemic has been increasingly politicized as well, many people cite HIPAA as an excuse out of wearing a mask mandate and to declare vaccine passports and mandates to be illegal. Neither of these assertions are true, but that hasn't stopped many people from still making them and even using them to avoid public safety measures that could be harmful to everyone. It's also gotten worse in the COVID era because of misinformation that's being promulgated through social media channels, which are so off base. And yet they're so asserted with high level of confidence, which makes people believe it. It's kind of like unringing that bell. There's even a HIPAA Twitter account that is HIPAA Bad Takes, and they misspelled it on purpose to give a nod at how often people who claim to know the law not only get the acronym wrong, but get the definition wrong. There's a massive amount of confusion as to who and what HIPAA really is and who it applies to. The information, the bad information, is just insurmountable. It's actually just ridiculous. So trying to get people to understand what a covered entity is under HIPAA or a business associate is really tough to really bring to the forefront because people don't even want to hear it. So let's talk about what it is. So what does that 1P, again, HIPAA, really stand for, if not privacy? It stands for portability. So HIPAA is short, in the correct acronym, for Health Insurance Portability and Accountability Act. The 1996 law origins lie in creating federal standards for digitizing medical claims, data, and records. That's the accountability part. And allowing employees to have health insurance coverage, including for pre-existing conditions when they change jobs. That's the portability part, the rights they did not have before the Affordable Care Act. So privacy provisions that most of us associate with HIPAA with today wasn't actually the focus of the law at the time. So when Congress was passing this law, they did realize that there was going to be this massive digitization of health information and health data, and there might be a need for some privacy protections. So it took them a few years, and they didn't do it immediately. And it wasn't until the end of 2000 and into 2002 where HIPAA privacy rules were finally issued and took effect. They were updated in 2013. So there are several elements to HIPAA, including provisions to prevent healthcare fraud, simplify and standardize medical records, rules for pre-tax employee medical savings accounts, and to ensure continuous health insurance coverage, again, for employees who lost and changed their jobs. For the purposes of what I'm going to explain to you, we're focusing on the privacy rule. This falls under its administrative simplification section, believe it or not. It's a very small section. HIPAA only applies to what are called covered entities. So who are those? Those are essentially healthcare providers, doctors, hospitals, pharmacies, for example, healthcare insurers, and healthcare clearinghouses because they process medical data. It also covers their business associates or contractors who have to handle medical records in some way to do work for those covered entities. So, for example, I'm a business associate of certain healthcare entities that have me audit their records. These parties are required to follow certain protocols to keep your protected health information secure and private. That's why I have to sign a BAA agreement. And that's why your healthcare provider or insurer might require you to communicate with them through secure, HIPAA-compliant channels and patient portals, or take other steps to verify your identity before discussing protected health information with you. So HIPAA's privacy rule also requires that healthcare providers give you, the patient, a notice of their privacy practices, that was the update in 2013, and allow you to access your own medical records. In fact, a lot of the HIPAA complaints from patients aren't about privacy, they're about the lack of access to medical records, which I explained in the Cures Act a couple of episodes ago. So again, if you think your HIPAA rights have been violated, you can complain to the HHS Office of Civil Rights, but that's a misconception that you think you're complaining so that you can go sue somebody. You can't. You can't even sue the alleged offender. The Office of Civil Rights has to take action, and if warranted, for instance, by issuing fines or even criminal penalties if they think there was an offender. But here is what HIPAA doesn't do, and it's really important to note this, and I hope some professional athletes are listening to this. Privacy didn't begin with HIPAA, and it's not the only health privacy law out there. There are other laws that protect certain types of health information. States have a lot stricter laws with things like Americans with Disabilities Act, which mandates that employers must keep disability-related medical information about their employees confidential. And the concept of the doctor-patient confidentiality has existed forever. That's part of the Hippocratic Oath, which again is not a law, and that trust is a necessary part of good medical care. So it's basically saying that if I'm the doctor and you're the patient and you come to me, you might tell me something that's very secretive, and I need to know that to give you the right care and diagnose you appropriately. So at the time, many of us freely gave away our health information to all kinds of places, or at the same time, I should say, people do this. And people who have really no legal obligation to keep that information private or secure. And with the internet now, there are more ways to do that than ever. I generally think that when you're talking about interactions with healthcare system, the likelihood that they're protected, and again, anyone who bills directly through digital means, those are part of your HIPAA-protected entities. But this is where it kind of breaks down. So let's say you're recording your steps on a Fitbit, or you're using a nutrition app on your phone. That's not a protected, covered entity by HIPAA. Let's say you tweeted your therapist appointment that you have, or you put a selfie on with your vaccine card on Instagram. Or let's say your membership in a Facebook support group for people who have STD. There's a new one out called the period tracker on your phone for females. The heart rate monitor on your wrist, or browsing, WebMD for information about your recent, lupus or cardiac diagnosis. Let's say you did a mail-in order, spit test for DNA. Or let's even say you took an Uber trip to the emergency room. That's all health information, and most of it is tied directly to you. You feel it might be sensitive, but none of that is covered by HIPAA unless protected health information is shared with a covered entity. So if it was your physician involved, or one of your let's say facilities that has a chart on you, then maybe it's covered. But for the most part, that wouldn't be the case. And then you've got the organizations that handle health data, but again, aren't covered by HIPAA, including schools, law enforcement, life insurers, even employers. They may be covered by other privacy laws, but HIPAA is not one of them. And so there's some things even during the pandemic that are actually covered by HIPAA, but have been given a temporary enforcement waiver under 1135 due to the public health emergency. So, for example, the Office of Civil Rights, and you've heard me talk about this in telehealth, they won't be enforcing the rule of HIPAA-compliant portals for telehealth, or will it require covered entities to use HIPAA-compliant systems to schedule vaccines, an issue that was a problem that arose recently because some portals crashed, so they turned to services like Eventbrite and event signing up services that can handle a lot of people to register. I think somebody even used Ticketmaster, and you think they're HIPAA entities, but it's not. They're tracking your information, and I'm sure that's why you're talking about some new shoes in your living room, and all of a sudden you get an email for new shoes or that concert ticket, because they're not HIPAA compliant. The other thing is when your physician engaged in telehealth services and the rules were relaxed through the pandemic, still through the public health emergency, you had to put something in the patient's chart that said you asked them or told them that you're aware this is not HIPAA protected, correct? And the patient had to have a response. And if you didn't disclose that, then you could be in violation if they end up having a breach in their phone or whatever platform they used. This is also something that you have to be careful of too, because this is only until the public health emergency ends as far as those flexibilities. But let's say if you go to Starbucks, again, not a covered entity, and refuse to wear a mask because you say you have a health condition. This is not a HIPAA violation if the barista asks you, what is your condition? Nor is it a HIPAA violation if Starbucks refuses service to you. They are not a HIPAA entity. If your doctor now were to walk into Starbucks and broadcast your health information to anyone within earshot without your permission, now you have a HIPAA violation. It would also be a good time to consider changing doctors. But fortunately, HIPAA allows you to request your information records and bring them to a new provider. And if someone else happened to record your doctor's outburst and put it on TikTok, believe it or not, that is not a HIPAA violation, even though it does include information that was once protected by HIPAA. So you have to be careful about when you're hearing something that says people are clinging to this data and protecting it, all the way downstream. Someone asking if you've been vaccinated is not a HIPAA violation. In fact, it's not a HIPAA violation for anyone to ask about any health condition you may have. It may be considered rude, but it's not a violation. A business requiring you to show proof that you've been vaccinated before you can enter is not a HIPAA violation. Your employer requiring you to be vaccinated and show proof before you can go to the office is not a HIPAA violation. Schools requiring that students get certain vaccinations before they're allowed to attend is not a HIPAA violation. Oh, and vaccine passports, which the Biden administration has already said they're not planning to mandate because, believe it or not, they have been around forever, are also not HIPAA violations. Think about the New York's Excelsior Pass. To use it, you are voluntarily giving the app permission to access your health records. And as the app's disclaimer states, I read it recently, says the website is not provided to you by a healthcare provider. So as such, you are not providing protected health information for healthcare treatment, payment, or operations as defined under HIPAA. So that's not to say there might not be other non-HIPAA violations at play here. Certain anti-discrimination laws could limit what medical information employers and businesses can require their employees or customers to provide. But even those laws do not, as we've seen, mean that businesses have to allow unmasked people or unvaccinated people in their establishments, or that they can't require employees to get vaccinated unless they have a medical or religious reason why they can't be. So this is where you have to really educate not only yourself but other people that HIPAA is not the all-inclusive health privacy law people assume it is, but that mass assumption suggests that maybe a law is both wanted and needed because HIPAA does have a lot of gaps that a privacy law could and should fulfill. And only this pandemic has made that pretty apparent. So a lot of people just assumed what it meant instead of actually looked and did their due diligence on what it actually meant. So you have to really be careful on what you put out there, what you assume, because it's not always accurate. And if anybody knows me, I am so about accuracy, details, and current information. So the one big thing, and I'll just leave everyone with this, HIPAA provides some protections, again, for our health information, absolutely. But technology has advanced much faster than our laws. So the Public Health Emergency Privacy Act that I know some Congress members are trying to introduce as a law, it's trying to protect consumers' information not only during the pandemic, but after the pandemic ends, because we have so much that's permeating in our lives that has digital means tied to it. So you really want to talk to your lawmakers, to your congressmen, to figure out, your public, servants, your representatives, let them know what you want. Because otherwise, let's say you're in rural America and Walmart is your only grocery store and your only pharmacy. And do you have to continue to shop online forever at an additional cost and expense because they decide to require vaccinations to enter their stores and you are not vaccinated or you don't want to wear a mask? And this isn't judgment. This is just saying, what if that is a requirement? And what if you're in that situation and you don't have a choice? You have to go there. So the digital divide could make things a lot worse for people in the short term if we don't have something that is put in place soon on the privacy situation, or if the vaccine passport system is done recklessly. And that's what I'm seeing could be happening. So that part is not a HIPAA take, but it is worth considering. So my 2 coding question todays have to do with the E&M guidelines, of course. You know, you guys are probably a little bit fatigued from 2021 E&M like I am, but you know, it seems like that was supposed to be easier, but we have so many clarifications need to be made. It's crazy. So here's one. It says, Terry, my doctor keeps saying at least 20 minutes are spent with the patient or over 20 minutes were spent, and he wants to get a level 4 based on time. Can you? That would be no. Now you have to be exact in your time, and you have to give activities that were related to that time if that's how you're leveling your visit. And 20 minutes now is a level 3, 99213, or a level 2, 99202 if it's a new patient. So that would actually hurt you if that's how they're documenting. A question came up, Terry, if a physician is doing a prior authorization for a patient, does it count in total time? So another time-related question. If the provider is personally calling for the prior authorization on the date of service when they saw the patient, so at that encounter, then you can include that in the time. But if it's done by the clinical or billing staff, then no, you can't. So remember, all time has to be the actual provider providing the service. It cannot be ancillary staff. And let's face it, our doctors don't do authorizations. They hand the chart off and said, get this patient scheduled for whatever they need. And so they just give the order. So make sure that you're clear on that the doctor isn't the one typically spending the time doing that. So for my personal tidbit this week, I hope all you Amazon shoppers will appreciate this out there. I'm currently remodeling a house, so it's been stressful because obviously Amazon's my friend by getting towel racks and, oh my gosh, new towels from certain places. And anyway, certain things don't always come from Amazon. They come from outsourced places. And when you unfortunately get a duplicate of something or you get something that doesn't fit by 2 inches, you have to return it, and you're thinking, great, now I got to box it back up. I hope there was a packing slip. Plus I got to take it to a mail center or the post office. Well, something you didn't understand is, or I didn't understand or didn't even know, is if you buy something from Amazon, make sure you click on, if you have to return it, go to orders, go to your item, go to returns, and it'll say, do you want to drop it off at Kohl's? And I was like, oh my gosh, there's one by my house. So I have a medicine cabinet that did not fit. I had to get a new one. And I had an extra bathroom shower fixture that I had to return. And all I had to do was click on that. They gave me a little printout label. If I wanted it, you didn't even have to do it. And I dropped it off at Kohl's and got my immediate credit for $150. So just letting you know if anybody needs that little tidbit, hopefully that helps you out because returning merchandise is a pain. So everyone, thanks for listening to the CodeCast podcast today. Have a great day and a great rest of your week, and we'll talk to you next week.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter @TerryCoder1 or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.